No one plans to get sick or hurt, but most people need medical care at some point. Health coverage helps pay for these costs and protects you from very high expenses. Did you know that the average cost of a 3-day hospital stay is $30,000? Or that fixing a broken leg can cost up to $7,500? Having health coverage can help protect you from these high unexpected costs, just like those. Now, there are other important benefits of health coverage, and that's things like the plans that are available in health insurance marketplace. Well, things like preventative care cover those as well, most of them for free. They also cover some costs for prescription drugs. Florida covering kids and families, well, they're up next on Bayside. Good morning and welcome to Bayside. I'm your host, Shelly Sanders. We're talking Florida covering kids and families, and that means we're talking to Miss Jody Ray. Welcome back to the show. It's always good to have you here.
Thank you.
It's been a little bit, huh?
Yes, it has.
Yeah, because it's that time of year again where we're talking about open enrollment, getting that coverage. So without further ado, maybe we have somebody that's new to the state, new to the area, and they're just starting to learn about these things, or they've heard of it, they aren't really sure about it, and how do they go from here? Where do they go from here? So let's go ahead and kind of back up and really talk about it, dive into what is covering kids and family.
So Florida Covering Kids and Families is an initiative at the University of South Florida's College of Public Health. And our whole purpose of our program is to focus on access to health care coverage. We work statewide, and we provide training, community outreach, enrollment assistance, education, anything related to access to coverage. And we're helping families all over the state.
Sure. Now, when helping families all over the state, now, how deep does that coverage go? It's covering kids and families. How does that work? I mean, I know we've got a lot of temporary residencies. We've got some people that are here that are helping out, certainly with some of the crazy weather happenings, the hurricane issues that we've had. So it might be a situation where they're here for a year or 2 years. How does this work for somebody, say like that doesn't have a clue that, oh, my child is covered? How does this work?
So certainly we've seen an influx of not only people coming in from out of the state, but people within the state that have been displaced because of the hurricanes. And so we've got assisters all over the state on the ground that are there that can provide that assistance to make sure that people can seek health care services while they're here. And they are providing enrollment assistance even to those that are coming in from Puerto Rico, but even those that had to move into other parts of the state,
right,
which could also affect your health insurance. You know, health insurance can be, for example, by county, so you may need to be able to get that assistance. So we got people all over the state doing that.
Absolutely. So bottom line, what we're getting at here is they've got incredible assistance when it comes to just calling. They'll help walk you through it, and it's very easy to understand, I guess I should say. So, okay, so covering kids and families, why should any one person not be covered? I mean, when we've got this health care available to children all over the state.
Well, we've got not only kids that are uninsured, but of course we've got the adults. And now we're in the middle of open enrollment. So one of the things that our program is doing is providing enrollment assistance for the health insurance marketplace as well. So we're not only enrolling kids who are needing coverage into the Florida Kid Care program, which is the Children's Health Insurance Program, but also we're enrolling the parents, we're enrolling the college students, we're enrolling childless adults, you know, this is the time of year, this is the season to sign up for coverage.
Exactly.
And we have 6 weeks to do that. And so not only do we have the people signing up the kids that we do all year round, but we have navigators all over the state as well. So our Covering Florida Navigators, which is our team of navigators that are statewide, are providing enrollment assistance for the federal health insurance marketplace as well.
Right. Let's talk about those deadlines.
Yeah, the deadlines are really important, particularly because they're different this year. And I think that's what a lot of consumers need to know. In the past, it's been a longer open enrollment period, but this time, open enrollment started November 1st and it ends December 15th. So to apply for January 2018 coverage, you have to have applied and enrolled by December 15th to get coverage for 2018, or you're out for the year.
Wow, that sounds pretty harsh, but that's the reality of it all. And what happens at that point? Well, talk to me a little bit about, okay, let's reiterate those dates, and then talk to me about the penalties of what happens if you don't.
So the dates, again, are November 1st or December 15th. So we are in our 6-week open enrollment period. This is a shortened open enrollment period. It's half the time that open enrollment has been in the past. But yet the same amount of people need to sign up for coverage, right? In the past, we've signed up. Last year, we had about 1.7 million people in Florida enroll into health insurance during the open enrollment period. Well, we still need to get 1.7 million people enrolled in half the time. I think it's also still important to know that the Affordable Care Act is still the law of the land, and we still have a mandate to have coverage. And if you do not have coverage, you will get a penalty.
Right, and those penalties can be pretty steep, especially if you're living on a very tight budget, for sure, most definitely. So, okay, so walk me through the steps of it. Maybe someone hasn't had it. I can't imagine why you haven't. Let's back up for a second. So that limited or the shortened time period to actually register, get enrolled, this open enrollment period, it's shortened. Is the theory behind that? I mean, my goodness, we should be used to this by now.
Well, we're not used to a shortened open enrollment period.
Well, used to, this is what you need to be accustomed to doing. Just like, you know, you have a certain time period to file your taxes, a certain time period to get your health coverage.
Well, I think that's true, but in the past, most consumers knew they had till the end of January, for example. So I think it's important to realize that, you know, some consumers may miss the deadline because they not be aware of the shortened enrollment period. So while they might be used to the fact that open enrollment starts November 1st, I really don't know how many consumers are going to be aware of the December 15th deadline.
Gotcha.
We are seeing a lot of response to getting the word out, so that's encouraging. But I think it's real important to realize that we need people to call and get an appointment. They can sit down with the navigator, review their plan choices, and we're finding a lot of consumers are finding different plans, better plans, cheaper plans than they thought they could get had they not sat down and reviewed what their plan options were.
So would you say it's advisable then for everyone, even if they had, if they were pretty satisfied with the coverage or the plans that they had from this particular year, would you say it's advisable to go in and talk and just to be sure, just to make sure there isn't a better option available?
I think we're finding that it is really advisable for people. They can go to www.coveringflorida.org and actually schedule an appointment with the navigator themselves on the website. Perfect. Or they can call the phone number and we'll get them scheduled with the navigator anywhere in the state. We're seeing people who are not only should review the plans because new plans come in all the time, but some people have been renewed or auto-enrolled into a plan that may not best suit their needs, may not have their providers on it, cover their medications.
Sure. So bottom line here is check it out. All right, you're looking at the website of where to go to get that done, to check it out. I mean, it never hurts to know your options. Coveringflorida.org, that's the website you're looking at right there. And don't worry, we'll have a link for you on ours as well, cw44.com. We'll be back. Welcome back to Bayside. I'm your host, Shelley Sanders, and I'm talking with Miss Jody Ray, Director of Florida Covering Kids and Families. Now, Jody, every time you come, it's almost like a re-education, or if you want to call it that, a re-education on insurance, and and something new and something different. When we left out, we were talking about it never hurts to go ahead and just check it out. Go to the website coveringflorida.org and just know what your options are. It never hurts to have somebody, a second set of eyes, look at it or give you a different perspective on it. Could save you some money in the long run. And speaking of money, there's also the penalties if you do nothing and get no coverage whatsoever. Now, I know it can be a little bit of an overwhelming issue when it comes to insurance, and there's also the stage of life. Maybe there's new adults coming into play that are no longer covered underneath their parents' insurances, and so this is the first experience they've had. And I know it can be kind of overwhelming to go, wow, I don't know where to go. Do I go to healthcare.gov? Do I go to coveringflorida.org? I have no clue. What's the difference? So would you explain that for maybe the ones that haven't gone through this experience before?
Sure. So to apply for coverage and to see the plans, anyone can go to healthcare.gov and view the plans and see what the plan options are. For assistance with enrolling, that's the Covering Florida team. And so they can go to coveringflorida.org to get an appointment and have the opportunity to sit down with a navigator that can walk them through. Health insurance can be complicated, and I think, I spend most of the time, and as probably most of the assisters, just explaining health insurance. Sure. Health insurance is complicated. Co-insurance versus co-pays, what are deductibles, what's the maximum out-of-pocket cost, how does all of this work together, and then also explaining how the tax credits or maybe cost sharing reductions come into play. All of that can be confusing to consumers. Sure. And so our job as assisters is to make sure that an individual who needs health insurance not only understands the plans they're looking at and what makes up the plans and the coverage, but what their options are. And a good example is I had a consumer come in who had been enrolled and the plan is no longer available. So they were going to be auto-enrolled into another silver plan. And that silver plan actually didn't cover any of her providers. And she needed a plan that did Sure. cover her providers. By the time we were done, she ended up in a gold plan that covered more of her providers and actually provided more coverage and less out-of-pocket costs. So for just slightly more than she was already paying for her previous premium. So she ended up with a much better deal once she sat down and really looked at all of her plan options.
Sure.
And so that's what the navigator's job is for. It's to make it understandable, make it so that a consumer can make choices they feel confident about and that really meet their healthcare needs. I mean, we look at the providers, we look at whether their medications are on there, and also you're looking at things like not just the premium cost, but what is a hospitalization going to cost? So, an estimation of what those costs could be for someone if something unexpected happened, like a broken leg, for example. We can look at a potential, out of pocket for that.
Sure, absolutely. I mean, it doesn't hurt I mean, there's a reason why they have the assisters, as you call them, the navigators, the assistants, all of these people. They're pros at what they do. They do this every single day. They know it inside and out. And it never hurts to go to someone who gets it, ever. I mean, and ask all those questions. What happens if? Or, could I save more money on this aspect? If you're a healthy person, what are your priorities? Do you care more about your budget on a month-to-month basis or for those accidents that no one plans for or hopes for? So that being said, the cost per month, that holds a lot of people back. Just the fear of, wow, gosh, I don't know, every month am I going to be able to pay my bills? How does that work? And is there financial assistance for those people that may be reluctant to come and apply because they're already in a dire straits situation?
Well, one way to look at it is We insure our cars and our home in case something unexpected happens. You don't buy insurance for what you know is going to happen. You buy insurance for the things that you don't know, right? And then the other aspect of being able to enroll into the coverage is that you get your preventive care for free. So you might be a healthy individual, but guess what? Now you get to go to your primary care for your checkups, you get your birth control for free, you get other cancer screenings for free, so you don't have to pay any more out of it. You get something for that money.
Absolutely.
Whereas for a penalty, you don't really get anything for that. You just get to pay $700 or whatever, it's $695 or 2.5% of your household income. That could be pretty painful, and you get nothing for that.
Exactly.
And so I think it's important to remember that most people who apply, particularly in Florida, also get some of these discounts. We know that over 90% of the people that applied in Florida in the past several years, they got tax credits that brought down the cost of their premium. We know that over 80% got cost-sharing reductions that also brought down the cost of things like the deductible and the co-pays. So their other out-of-pocket costs came even lower.
Wow. So in the long run, in the big picture, what we're saying here is get it checked out. You're going to save money one way or another by going ahead and getting the coverage because you're going to get something out of it, even if it's preventative care. All right, there's the website you're looking at, coveringflorida.org. We've got more to talk about, but we can't do that until after this. Welcome back to Bayside. I'm your host, Shelly Sanders. We're talking all about Florida Covering Kids and Families and open enrollment. It's been going on now. You've got about 2 weeks left, just over 2 weeks, right, Jody? I mean, and let's just go over that again in case somebody is just tuning in. How important is that to know that you have however many days, do the math, you have just over 2 weeks before this enrollment period is done? Then what?
Well, December 15th is the last day to
Right.
sign up for coverage for 2018. That is it, which is much less time than consumers had in previous years.
Sure.
It is so important that people know that they have less time and they've got to do something now. And if they're already enrolled in a plan from 2017, they would have gotten a letter telling them whether their plan is going to continue or whether they've been auto-assigned to another plan if their plan is no longer available. It is highly recommended that consumers take the time to look at the other plan options. They certainly can do that on their own by going to healthcare.gov. They can log into their own accounts. They can look at the C plans, or they can sit down with a navigator who will assist them with reviewing the plan options and looking to see if there is a better plan option for them that may be more cost effective. Maybe they want to make sure it covers all the providers. Again, if you're getting auto enrolled into a plan, it's possible that you got a plan that isn't covering your providers that you go to. And so consumers should be very, very aware of what plans they're in and if that's going to meet their needs.
Now, to that point, if they're auto-enrolled again and they're thinking, okay, I'm auto-enrolled in the same plan, the plan's still the same, could your providers change?
Sure, provider networks change.
So at the end of the
time.
day, just because your plan hasn't changed doesn't mean that something hasn't. So it's always advisable to check it out, right?
Absolutely.
Okay. All right. And again, you can do that by going to this website right here. Look at that, coveringflorida.org. That's the website you're going to go to. It's going to give you all the information you need and then some. And remember, December 15th, that's actually less than 2 weeks away. Better get it done if you haven't already. We'll be back after this. As always, I want to thank you at home for joining us this week on Bayside. And Jody, thank you for coming. You're always giving us just this great information, answering a lot of questions for us. If you still have questions, though, you want to log on to coveringflorida.org. You can also go to healthcare.gov, but go to coveringflorida.org. That'll give you all the information you need. It can also set you up with an appointment with one of the assisters to really help you get all those questions that you may have answered and check on the current plan that you have. All right, I'm Shelley Sanders. We'll see you next week.